The nurse cares for a group of clients who are dependent on caregivers. The nurse suspects which caregiver of physical abuse. The caregiver calling the client a stupid, ugly idiot. The caregiver secretly watching the client undressing. The caregiver pressuring the client to eat more quickly. The caregiver ignoring the client's dirty appearance. The answer is the caregiver pressuring the client to eat more quickly. Physical abuse occurs when a caregiver uses physical force, such as force feeding, hitting, biting, scratching, or any other type of physical punishment. Clients who are most at risk for elder abuse are over 75 years old, female, physically or mentally impaired, and rely on their abuser for care. The nurse continues to assess the scenario for additional information regarding suspected abuse. Note that even if abuse is suspected or confirmed, a legally competent adult cannot be forced to leave an abusive situation. Emotional abuse of the older client occurs when a caregiver humiliates, threatens, harasses, or coerces the client with either words or actions, resulting in the client's emotional distress. Calling the client a stupid, ugly idiot is considered emotional abuse. Physical abuse of the older client occurs when any person, a stranger, or caregiver uses physical force to cause injury such as hitting, pushing, scratching, shaking, or force feeding. Force feeding or pressuring the client to eat more quickly may be physical abuse. Continue to assess the situation for additional information. Neglect of the older adult client occurs when a caregiver fails to meet the client's basic needs of food, clothing, shelter, and hygiene. A caregiver ignoring a client's dirty appearance may be neglecting the client. Sexual abuse of the older client involves unwanted sexual interactions and may be physical, such as unwanted physical contact, or non-physical, such as forcing the client to watch pornography. Secretly watching a client undress for sexual pleasure is a non-physical form of sexual abuse.